30% of all deaths in Canada are related to heart disease, but this leading cause of death is also the most preventable because your lifestyle plays a huge role. This week on Family Fit, Grover learned what his lifestyle has done to his heart until now and why making healthy changes could mean years added to his life.
This isn't the most fun Grover has had all summer. Truth be told, he hasn't been to a doctor in quite some time.
6 years.
But for someone with a strong family history of heart disease, knowing what's at stake can be important motivation.
Usually the #1 symptom that people get from heart disease is death. So it's important to pay attention to your heart health.
Calgary's Heart Fit Clinic is a private cardiac rehab, maintenance and prevention center. An initial assessment takes about 3.5 hours and includes an ultrasound of Grover's carotid artery.
This is the artery here, yeah, that's his jugular vein up here.
The results are a little frightening.
We're measuring the thickness of the arterial wall. So what happens here is indicative of what's going on inside the heart. So it's overall showing your arterial health.
The test shows this 40-year-old has a vascular age of 54, meaning his heart is almost 15 years older.
Shocking. Yeah. Totally shocking. Because you feel fine, right? So yeah, that's a sobering thought for sure.
As it stands now, Grover is at an increased risk of heart attack and stroke. But all of that can be turned around.
Now it becomes important to focus on doing a clinical exercise programs, focusing on nutrition programs, stress management, so we can reverse that disease process. And we've seen that a lot here.
It's difficult news to hear for this father of 2, but after 2 weeks of clean, healthy eating and exercise, he's now more aware of what's at stake, hoping that his reality check will inspire others to check on their own heart health.
I think it's vital that people do it, right? Especially for parents, especially I think for guys when you get around the age of 40. For my boys, man, I want to be able to be around for another 30, 40, 50 years, and I know that if I continue this path of really being undisciplined, that I'm not going to be around a whole much longer, so.
Well, that gives you an idea of Grover's reality, doesn't it? So what about you? What are your risk factors? What can you do? We're going to talk about that coming up after the break. So we saw Grover go to the Heart Fit Clinic and the experts take a look and look at his risk factors, and it turns out that Grover's got some issues, and he's going to have to address those in order to get the most out of life. So Diamond Fernandez from the Heart Fit Clinic, you've got him organized now. You took a look, there were some risk factors, there were some things that needed to be changed, and you folks have got Grover on a bit of a different path now. We're going to follow Grover, but can you do that for anybody?
Absolutely. I think it's important to have people understand really what their overall risk is of heart disease and stroke, especially since it's the #1 cause of death of men and women, and it's also the #1 preventable disease.
Okay, how can we prevent it?
How can we prevent it? It's really,
what are our steps that we need to do?
Well, at the Heart Fit Clinic, we create lifestyle modification programs to improve their heart health. So that includes exercise programs, and when I say exercise programs, they're clinically supervised exercise programs, so we're monitoring them clinically. We offer nutrition programs and as well as stress management counseling.
Boy, that stress management counseling, stress.
Yes.
It's got to be a huge part of what you see the results of every day when you're looking at people's heart health.
Absolutely. I mean, stress is a huge risk for heart disease and stroke, especially leading to anxiety and depression, so that's an important risk factor.
Okay, so if we want to come to the Heart Fit Clinic, you can do some of those non-invasive. You're not doing open heart surgery. Dallas is not heading in there or Diamond's not heading in there to check us out in open heart surgery. You're doing the non-invasive testing.
Absolutely, and we look at their overall risk factor profile. We find out what their current level of fitness is, but more importantly, we have the most accurate screening test of detecting your risk of a heart attack or stroke, and that's a safe, painless, non-invasive test with no radiation. So it's a quick measurement screening to find out really what is the age of your heart or how old your heart is.
And there's no accounting for genetics?
No, you know, we see people who have a family history of heart disease, people who are concerned about their heart health, or those with high risk factors to heart health. That includes diabetes, obesity, high blood pressure, even high cholesterol.
Okay, so the procedure would be someone would call, say, you know what, this might be a concern, or their family doctor might say, you know, we need to look at some of your risk factors for heart health. A person would come to you, you would do an assessment, you would get them on a path, and you would stay with them. This isn't a situation of, you know, cut out fat and beer, sleep more and exercise more, see ya.
Yeah.
You've got to accompany them on their journey.
Absolutely. A lot of people just do our comprehensive assessment with the carotid IMT at the HeartFit Clinic, but a lot of people, you know, go onwards to doing our lifestyle modification programs with our clinical exercise programs, nutrition and stress management programs. And that's really the best part, and the best part of my job personally is when people come back for their subsequent assessments or their assessment 6 months down the road or a year down the road. Expect we see Grover. It'd be nice to see the changes that what goes on in his heart health.
And we will, because we're going to continue to follow Grover.
Absolutely, and that's the best part, is to see the reversal of the disease process.
Okay, so that's important for people to remember. You need to know your risk factors. You need to know what you can do to lower those risk factors, and then, as Diamond is saying, you know, reverse it, because heart disease is preventable. Thank you.
No problem.
I'm sure we will continue to hear more from you as we continue to hear more from Grover and his family. Diamond Fernandez at the HeartFit Clinic.